treatments or
yeah.
habits like that.
Yeah. Yeah, these are some really good questions. Hi, I'm Dr. Durowade from Dardur Gynecology, and I'm excited to answer your Reddit questions. So the first Reddit question is, what is the normal time to get your period back after an IUD removal? Answer is your next period. So your IUD does not affect your ovaries where you ovulate from. Your IUD works locally within your uterus, so every month you're still ovulating, but your IUD is preventing your periods from being heavy and preventing sperm from fertilizing your egg. IUD does not determine when your period comes. Your IUD determines how heavy your period is, how painful your period is. So your next period should follow your normal cycle schedule. All right, your next question, what's healthier to use? Period cups or discs? I've heard that tampon chemicals can be harmful to us. So with period cups and discs, the important thing is proper placement and not leaving it in for too long so that it doesn't leak. So make sure you're taking it out, washing it, changing it before putting it back in. But with tampon, leaving it in for too long, you're still at risk for toxic shock syndrome. So when tampons first came out, they were highly absorbent and they had this chemical in them causing something called toxic shock syndrome. People would have like rash, blood pressure would drop, they would get really sick, their organs would be damaged, and so they pulled a lot of the tampons off the market. So tampons are better now. They don't have that chemical in them, they're less absorbent, and so they're safer to use. However, you can still get those kind of symptoms if you leave your tampon in for too long, if you wear a tampon the entire time you're on your period, or if you use those highly absorbent tampons that are still on the market. So tampons can be safe to use if you're responsible in using them. For period cups or discs, it depends on how you place them. Placement is the most important thing with those. There's not really any medical reason why one would be better over the other. How common are painful periods and painless periods? So this really depends on your anatomy and physiology. Some people have painful periods from when they started having periods. Some people have never had pain with their periods. So it really depends on the individual person. But your periods can also change as you age. After childbearing, your periods can change. Birth control, your periods can change. You also have some medical conditions that can make your periods painful. Fibroids, endometriosis. So you can develop things as you get older that can make your periods painful. I would recommend seeing a gynecologist to have it checked out. I recently just had a cycle that lasted 79 days. I've also had a 51 and 72 day cycle. My usual cycles are 29 to 26 days. Should I be worried? Yes. So a normal cycle is 25 days to 35 days. You have to be within that time range for you to be considered normal. If your cycle rather is lasting longer, then something's wrong. And I did a menstrual cycle video recently. We'll post the link here. Different things can make your periods abnormal. It could be pregnancy, breastfeeding, thyroid problems, PCOS, brain tumor. There's actually a brain tumor that can, make your periods abnormal. If your periods are not within the normal range, you should be worried. You should see a gynecologist. Periods that are only lasting 2 days and no cervical mucus. As long as you're having a flow, even if it's just lasting 2 days, but it's regular, meaning it's consistent every month, that's a normal period. Increase in cervical mucus happens like 2 weeks before your period. So if you're not having a lot of cervical mucus during your period, I'm not as worried. What I'm more concerned about is, are you having a flow or is it just spotting for those 2 days? Then that's not normal. Flow, even if it's just 2 days every month, okay. No flow, just spotting, not okay. So make sure you make an appointment with your gynecologist to have that checked out. So those were all the questions. I hope that those answers made sense and they were helpful to you. If you have more questions, post them below. I'd be happy to answer them for you. If you're interested in learning more about your menstrual cycle, make sure to check out this menstrual cycle video. This has been Uncommon Knowledge with Dr. Durowade from Dardur Gynecology, where we make uncommon knowledge common. Thank you for watching. Is that what we said?
Yeah,
okay, good.
Okay.